Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Bharat N. He has done MD Pediatrics and after that he has done fellowship in neonatology. Now he is working in Chinmaya Mission Hospital as a neonatologist, and day in and day out he sees the newborn babies, and many a times the mothers are concerned because the babies will have either the pimples or the rashes, or they have some birthmarks which are very huge, and then they become very panicky. So what do you tell the parents when to worry and when not to worry?
Yeah, thank you. Thank you for the introduction, madam. Uh, as you told, I'd like to start with something like what is newborn skin? Why is someone worried? Should be as a parent, why they should be worried about newborn skin is, as you know, before birth, baby will be inside uterus protected by water. So as soon as they come out, they are devoid of this protection. So it's our responsibility to protect skin because of the properties such as the layers of the skin is very thin in newborn. And you also need to understand that the layers of skin, not just thin, they are as well loose so that it slides over and there is an easy chance of damaging that skin if you don't take care of it. So that's why we need to protect that skin, madam. With this, as newborn, as you see the newborn baby, the baby will not just have skin, it will have some white layer over the skin, which is
Correct.
called
Casing.
vernix. Yeah, it appears like a, say, curd like or a milk like or a fat like, which is a protective layer which is given by God, which will be present all over body. Previously, while giving birth, we used to wipe it, but now, as we understood that it is a protective layer over skin, we seldom remove it or we seldom try to rub it off because it forms a protective layer which protects against, say, acts as a moisturizer and it protects against infection, it protects against damage of the skin, and also keep the baby warm. So with these advantages, we don't have to remove the vernix caseosa, which is a protective layer for the skin.
So God given first armor for the baby.
Yes, yes, exactly.
To protect from four things, one this thing, and it is protecting for four. And then, some of them, they start developing. Then if you say that it should not be washed, when should we give the bath? And how should we give?
Usually bathing should be delayed. The recommendation even says, and even that's what we have been practicing. We usually delay bathing till the cord falls, the umbilical cord falls. Before that, in Indian culture, it is common for newborn to be bathed after 9 or 11 days of life. That's exactly the duration where the cord falls off. Before that, if a parent wants to clean, they can do tepid sponging, or I see that like what I can say is they can dip cotton cloth in a lukewarm water and they can clean the baby's skin using that. The
And
entire
that also must be sterile. The cotton must be sterile and the gauze must be sterile. So they should not use the dirty one, and then in fact the clean skin can be made dirty or infective with that. So they have to be very careful with that.
Very careful with that. So once 9 to 11 days gets over, probably they can start bathing. Bathing can be in different position. Few parents, like in Indian scenario, it is common for us to bath putting baby on
our
thighs
legs
or
and the
knees.
lap and then clean it. Yeah.
Exactly. Protecting
And
their eyes and ears.
yeah, we protect the eyes and the ears, and then everything, even the umbilicus. I remember, closing the umbilicus and pouring the water around so that the water doesn't thing. But my concern is, you told about the lukewarm water. That is okay. But what type of oil should be applied? Because everybody thinks that the child requires the oil bath. So if the oil bath has to be given, which oil to be used and which should not be used?
Better to stick to a basic oil like coconut oil, virgin coconut oil, which is non-scented, doesn't contain any irritants. Better to avoid, I would say, those like what we have seen is in North India, people do use mustard oil. So the mustard oil is bit pungent, and around 50% of those kids will develop irritant contact dermatitis. They'll form
Okay.
they'll cause irritation of the skin. That's why we advise to avoid. Others, such as like previously we used to tell to use like advice to use olive oil. Now for the risk of eczema, we have been not advising olive oil as well.
Hmm. And this baby oil, perfumed ones they were using.
It
And yeah, what do you say about it?
should not be used, madam. The baby doesn't require perfume. Anything perfumed, be it soap, be it lotions, or be it oil for that matter, need not be perfumed. They don't want perfumed oil.
Hmm.
Yeah.
Because perfume itself can cause irritation and dermatitis, and that's how
Yeah.
we know it should be simple coconut oil or til oil, that is the sesame oil. That also is very safe. That's what is used in the South India and many of the
Yeah.
North Karnataka area also. Now you told about the oil and you told about the lukewarm water. But what about the powder? Afterwards, many people are, fond of putting lots of powder around the neck and the thighs and the arms and the axilla. And that talcum powder itself can cause problem. No, what is the what do you say?
Yes. Like we definitely don't recommend any talc powder in infants. In fact, one, they don't require. The second thing is it might cause some problems. It usually blocks ducts, be it sweat pores or sebum pores duct. It blocks the ducts and it causes skin problems. And also it can induce allergy. It can cause recurrent cold, means repeated episodes of cold. So that's why we tell to avoid talc powder
Okay.
in less than 1 year. We usually
Okay.
don't recommend talc at all, madam.
Okay.
And I myself have stopped using talc since probably last 10 years.
Okay, okay, that's so good. That's so good. I also don't use. Okay.
Yeah.
And now, that sometimes the children are born with the varieties of either the pimples or the rashes. And
Yeah.
how do you console the parents which are
Yeah.
to be worried and which are should not be worried about?
In fact, a very common concern for parents is that, doctor, my baby's skin should be as
Hmm,
glowing as it should be, like that.
hmm,
In fact, yes, there are certain common skin conditions which parents should observe. It's not
hmm,
like it should observe, because there is something called as Mongolian spot, which is usually seen on the back.
hmm,
It is a patch. You won't
hmm,
be able to feel it.
hmm.
It is just seen. It is either slate
Okay.
gray or green colored,
Hmm.
and which usually persists for 1 year and disappears. The
Okay.
other
What
kinds of
about the
rash,
salmon patch?
yeah, that is a red patch, madam. Actually,
Hmm.
and usually the salmon patch is common over the occiput, means like this
Yeah, back of the neck.
back of the
Yeah,
neck. Okay,
just above the neck. Okay.
if you see a red spot will be visible there, which will persist as they are sleeping on their back. It will be
Hmm.
persistent till 6 months. After that, it starts disappearing,
Okay.
which is
Okay.
again doesn't require any treatment. Likewise,
Okay.
there are certain red spots which baby develop on day 3 or 4. We call it as erythema toxicum. That as well
Okay.
doesn't require any treatment at all. It disappears on its own.
Okay.
So
Okay.
these are the
So
common
that
rashes.
that is not due to allergy, because the older people they get that sort of rashes when the allergy occurs. So this has
Yes.
got nothing to do with allergy.
In fact, if at all, if we have to dig in, it is still an allergy, because
Hmm.
a baby who is inside womb surrounded with water, you start
Hmm.
putting clothes, they get allergy to
They
that
get
clothes.
allergy. Yeah, 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 yeah.
Yeah.
That's
But if
also
you don't,
very important. Putting the soft cotton clothes is very important. Any nylon or anything that can cause damage and allergy. Now,
in
if the
fact,
allergy occurs, you can put the lactocalamine or calamine lotion or no.
ma'am, like erythema toxicum, here the
Hmm.
problem is skin treats cloth as foreign. So that's why it
Hmm.
is causing rash. It tends
Okay.
to disappear by 3 days. If it is not, then
Okay.
only I would
Okay.
recommend any emollients. If not, no.
Okay. Otherwise, no. Okay.
No.
If it doesn't disappear in 3 days, then you can treat. Otherwise,
Yeah.
allow it to disappear and it's one. And
Yes.
sometimes they get the pimples also. Why is
Yes.
that?
Ma'am, because of the hormones which gets transferred from mother to baby, they do
Hmm.
get, like newborn babies do get pimples in the first 1 month
Hmm.
of life.
Hmm.
Not
Hmm.
all, like it doesn't come, it comes in crops. It comes at times and then disappears and again reappears. This is the
Okay.
simple thing which I tell is mother can apply her breast milk to those things.
Ah, very nice.
Mm.
Very nice. The
Mm.
mother's milk itself acts as an emulsient and then it
Yes,
cleans the whole thing. And it
yes,
contains the antibodies also
yes,
to
yes,
prevent the
absolutely.
infection.
Yes, yes,
Excellent, excellent.
yes,
And
yes.
what about the white spots? Sometimes tiny white spots are seen. What are they?
They are actually like skin contains sweat gland as well as sebum glands, that is like fat glands. These fat glands gets blocked due to various reasons, and that's when you start appearing, especially common on the nose as well as face, on the
Hmm.
cheeks. You see
Hmm.
white dots on the nose. We call it as milia. Again,
Hmm.
we don't intervene or we don't treat this. It usually disappears on its own.
Okay, okay. Now that we have taken care of the skin, we have taken care of the oil and the bath. How do you put the baby to sleep? Where do you
Yes.
put? Because some people tie the cloth, I mean, sari, and then make like a hammock, or some people
Mm.
have the cradle, some people have the other things. Which is better?
The best trend is always, which is always recommended, is to put the baby on cradle, on their back. Baby shouldn't sleep on their tummy.
Tummy,
They should sleep on their back,
back.
especially on a firm surface mattress.
Yeah.
The mattress shouldn't be too soft because if the baby turns, it might obstruct the baby's breathing. So that's why
Okay.
it shouldn't be too soft. It should be firm.
Too
Baby
hard
should sleep
also.
on
Yeah, it should not be too hard also. Otherwise, the head will become flat.
flat.
Okay.
Head will become flat. It should be firm, so it should not
Hmm.
be hard. So
Hmm.
and there should be distance between baby and the cradle wall.
Quite
There should
big.
be,
So that it doesn't injure the arms when it is moving the hands and the legs.
yes, so that
So
the
do
baby
you
as well
prefer
can
it to
move.
be wrapped? Do you prefer it to be wrapped and then put to sleep, or just allow it to keep the hands and the legs free?
Like baby will give an indication, madam, because swaddling is a excellent way of soothing baby. We
Hmm.
call it this as swaddling, where we cover the baby.
Hmm.
That's an excellent way to soothe the baby and put the baby to sleep.
Hmm.
As day goes, baby
Hmm.
won't like it. Probably
Hmm.
after 2 weeks, baby won't like it. You
Hmm.
have to remove it. You have to allow
Okay.
baby to relax and move its
Hmm.
limbs. So at that
Okay.
time, I would not recommend continuing swaddling for a long time. It would be
Okay.
helpful at times when the babies are fussy
Okay.
or struggling
Okay.
to sleep. Yeah.
Okay. So thank you very much, Dr. Bharat. You
Thank
told very important point that the baby is born with the natural, what to say, cover to protect it, and
you.
that should not be cleaned. And you also
Yes.
said the powder and the perfumes are not to be used, and then
Yes.
unwanted expensive oils are also not required.
Yes.
And then you
Yes.
said that the baby, not to worry if the rashes occur and they will disappear within few days. And thank you
Yes.
very much for your all the tips, and this will go a long way for educating our young mothers. Thank you, Dr. Bharat.
Thank you. Thank you. Thank you, madam.
Namaskar.
Thank you.
Namaskar.
Namaste.